This was a 10-year-old who had an avulsive injury on tooth number 8. He went to the ER and they replanted it, but the splint broke. So he came back to see me. This tooth was pretty mobile. We did a limited field of view 3D CBCT, and this is a 3D bone rendering. And what we're looking for any fractures in the root. We also are looking for any fractures in the maxilla. So we can see here that the ER actually did a pretty good job in putting the tooth back. However, when they placed the splint actually came off, as reporting from the mom, within 24 hours, and the tooth was really mobile. So when we did the 3D image, we wanted to make sure everything was intact. We can look at the PDL. Here we can see that the tooth was actually reimplanted pretty good. So we wanted to secure this tooth in place a little bit better. So we numbed this patient up. I like to use the electronic anesthetic device, and I like to use the bupivacaine with no epinephrine because there is no sting, and this is a very comfortable injection. So once we got this patient numb, I wanted to make sure that the tooth was in the socket really well. So I used firm finger pressure to make sure the tooth was in place. And so as we were giving this kid the anesthetic, we was checking on and make sure he was doing okay. So we isolated the tooth with a cotton roll. We also placed gauze in the back of his throat. We also used a mouth pillow, and we wanted to make sure that he does not aspirate any of the material or even the new splint that we're going to put in place. So this is the etch that we're putting here because we want to make sure that the splint holds very well by the composite. We put the etch on for about 30 seconds. We let it sit, and then we rinse it off very well, and then we air dry it here. And we're getting ready for the composite material in place. We make sure that the area is very dry and the patient stays very comfortable during the procedure. So as we were drying everything out, we wanted to also place some bonding agent here. So we placed a little bonding agent on tooth number 8. We also placed a little bonding agent on tooth number 9. And tooth number 9 was really stable. So tooth number 9 we used as the anchor tooth on this case in order to place the new splint on this case. And when we have the splint, we want to make sure we use a non-rigid splint, a passive splint. So this is us curing the bonding agent here, and this is the composite that we're placing on the side of the tooth and making sure that this new splint stays intact. And we use just a basic composite. We use the shade A2 just to kind of make it a little bit more aesthetic for the patient here. I like to use the buccal surface because it's easier to place the splint on the buccal area versus on the lingual area. Now the lingual area obviously will look nicer because you can't see it, but it's very hard to isolate the lingual on cases like this, especially this kid has a lot of crowding here. So we want to make sure that we secure the new non-rigid splint very well. In fact, you can use fishing line. You can also use orthodontic wire. So we decided to use orthodontic wire in this case because we wanted to have this tooth to have some physiological movement. And when we have physiological movement on cases like this can help prevent resorption and also ankylosis. So this is us curing the orthodontic wire in place here with the curing light. And we cured it for probably about 1 minute each tooth. So this is us here. We're trimming the excess orthodontic wire here. We're making sure there are no sharp edges to make sure this patient have a very comfortable fitting of the splint, and to also make sure this splint does not come off. So you can see here I'm checking to make sure everything is solid. Also, what we want to do, we want to make sure that we take the occlusion completely away. Now this patient, he had an overbite and his lower anterior teeth were slamming into this tooth even after it was reimplanted. So I'm adjusting the occlusion here just to make sure everything is solid. So this is the end result. So when you have a case like this, the immediate management, you want to pick up the tooth by the crown. You want to try to put it back in as soon as possible. If you can't, you want to use either cold milk or Hank's Balance solution. And when you get the patient in, you want to make sure you use a flexible splint for about 2 weeks. If it's a closed apex, you are going to start root canal therapy in 7 to 10 days. And you want to follow the patient up in 2 weeks. You want to remove the splint. And also, you want to make sure that you get this patient back as soon as possible for a recall. I would recommend a 6-month recall as well.